Welcome to NC Massage School, ncmassageschool.com. Today we're going to learn neuromuscular therapy on the posterior compartment of the leg, specifically the superficial muscle, the gastrocnemius. Go ahead and put your foot on the gas. The gastrocnemius, the tendon itself, the Achilles tendon to the calcaneus bone, relax, and to the underlying soleus, as well as the deep flexors of the foot. First thing we're going to do in any NMT treatment is do some myofascial stretching. We're going to hold each one of these positions for 1 minute and allow the connective tissue to become more soluble with our heat and mechanical force. And for time constraint, I'm going to move on, but try 2 or 3 different positions, 1 minute each of myofascial stretching. And then move on to rolling at the client's comfort level. Is that too much? No. Rolling the entire area. The connective tissue can be sensitive, the fascia can be sensitive, so check in with your partner. If rolling is too sensitive for them, try slowing it down a little bit. If it's still too sensitive, then just go back to myofascial stretching only. This is dry work and needs to be done first before you apply lubricant. Once you've applied lubricant, it's very difficult to go back and stretch. That's step 1 in your routine. It should take about 5 to 10 minutes. Next, we're going to do opposing thumb effleurage on the Achilles tendon and begin to treat the muscle, working distally to proximally. Going to place either thumb on the side of the Achilles tendon at the base of the calcaneus. Compress your thumbs together for about 10 seconds. And then friction, linear friction, and continue. Compress for 8 to 10 seconds on the Achilles tendon, and then linear friction. This is going to help to relax the muscle by way of the Golgi tendon organs, inhibiting muscle contraction. Compress and friction. The next step, as the Achilles tendon begins to broaden and flatten out, is to continue treating the tendon with now flat compression. Step 3. This is going to require 2 or 3 lines of treatment to cover this area thoroughly. Compress for 8 to 10 seconds, and then linear friction 3 to 9 times, depending on the client's comfort level and tonicity of muscle. Friction is linear, going in the direction of the muscle fiber, and pressure is in one direction only. You're going to compress and friction the entire flattened part of the Achilles tendon, as well as the underlying flexor and soleus. We're treating this area because the client has came in and has common complaints such as calf cramps, or maybe pain along the instep of the foot would indicate perhaps trigger points in the gastrocnemius. So as we continue to treat the gastroc, after we've done that, the next step is deep stripping thumb effleurage to this area that we have thoroughly compressed and friction. Only to this area. Do not lubricate this area yet. We're going to do pincer compression, and we don't want to slide. So go back after you've compressed and frictioned the entire area and effleurage 8 to 10 times each line. To reassess the tissues, see if any areas need to go. You need to go back and retreat with compression. Again, we're treating the Achilles tendon of the gastrocnemius, some of the underlying soleus and its convergent tendon, as well as the deep tibialis posterior and the deeper yet flexor digitorum longus and flexor hallucis longus. All are being affected with this deep stripping effleurage here. Now to thoroughly treat the gastrocnemius muscle belly, where most of the trigger points are going to be involved, we're going to do pincer compression, which is step 5. And we're going to start with the medial belly. Go ahead and put your foot on the gas. We're going to start on the medial belly, relax, and pincer compress, either with opposing fingers and thumb or opposing fingers. This is just skin. This is the gastroc. And we're going to use communication now. Will you let me know when this feels just right, at mild discomfort?
Yes. Just right.
Okay. And at this level of pressure, she says it feels at mild discomfort. We're going to hold for 8, 10, 12 seconds, as long as it takes, until she says it feels better. It's eased up. The muscle softened. It feels like you're not pressing as hard anymore.
Feels better.
Okay, the client said it feels better. The tension has released, and I'm going to do just a little bit of friction there to further coax the tissues apart and come out. We've gotten one release at this area of the gastrocnemius. We're going to go to the next area above it. And again, trigger point pressure, release with communication.
Just right.
And just take a nice relaxing breath, and as you exhale, the muscles will soften.
It feels better.
Okay, so this area has released. And do a little linear friction. Go to the lateral belly of gastroc, which is a little more challenging to pick up, and use opposing thumbs. Nothing.
That's just right.
Okay, she said that a little quick, means I must have been a little fast, so I backed off a tad. Am I still at mild discomfort?
Yes.
Okay.
Eased up.
Okay, it's eased up. We've got one release here on the lateral belly of gastroc. Do a little linear friction, and repeat. Repeat. Okay, that's the bulk of this work, is pincer compression with trigger point pressure release communication. Go back and check it again. Get another release or two, especially the medial belly. There's plenty to work on there. Okay. The underlying muscle, now we can start to address afterwards. After we've done pincer compression, we're going to go back and apply lubricant now to this area and do deep stripping effleurage over the entire area that you've compressed with pincer compression. Okay? 8 to 10 times each line to thoroughly assess and treat. Any areas you feel are tight, then you can go back and do flat compression on them. The underlying muscle has already been indirectly affected, and that's the soleus muscle, which comes out on either side here a little bit. The soleus muscle primarily refers pain to the heel. Its nickname is often known as jogger's heel. And also the underlying tibialis posterior can refer pain to the Achilles tendon, often nicknamed runner's heel, tibialis posterior. The deep flexor muscles often refer pain to the sole of the foot, and flexor digitorum to the second through fifth toes, and flexor hallucis longus, of course, to the big toe. These muscles of the posterior leg are often overloaded from excessive plantar flexion, such as in walking upstairs, climbing a hill, jump rope, high heels, or shape-up shoes. Tight circulation, tight elastic socks, immobility from a boot or a cast. All these things can create hypertonicity in this muscle. The soleus can also limit dorsiflexion, while the gastroc will have no limited range of motion.